Hello, my name is Al Cannon. I am the Sheriff of Charleston County, and I want to talk just briefly about some of the resources that we have and the relationships that we have built over the years dealing with mental health. We're greatly fortunate to have had a mobile crisis team. They have been throughout history a tremendous resource for us and has been the model for similar mobile crisis teams around the state. Through that relationship, we began to enhance our understanding and ability to deal with folks who are experiencing emotional distress, mental health crisis, and I think we do a very good job today because of groups like NAMI, who have come in and have been very instrumental in helping us to get crisis intervention training. The relationship between the Charleston County Sheriff's Office, other law enforcement agencies in the county have been enhanced dramatically because of the participation of these great mental health care professionals and organizations, NAMI being the primary one that we have been dealing with.
Sergeant Casey Owens with the Therapeutic Transport Unit. The Therapeutic Transport Unit was created in the early 1990s by the sheriff who had a vision to meet the ever-growing needs of the mental health community in Charleston. We have 6 full-time deputies. We handle mobile crisis calls from picking patients up from their residence or anywhere else in the community and taking them to a local hospital. We work closely with the hospitals throughout Charleston County, doing hospital-to-hospital transports, and then we also transport patients throughout the state. The Coastal Crisis Chaplaincy has provided the Sheriff's Office with comfort kits to give to children who are in a stressful situation to help alleviate some of the stress and pain they're going through. We also have DVD players and DVDs that we can put in our vehicles to transport these children from facility to facility. With the training that our deputies received with NAMI and mobile crisis, they're able to better handle the situation with the best care for the patient and everyone involved, to include the deputies.
My name is Alyssa Rookie. I'm a licensed professional counselor working for the Department of Mental Health through Charleston Dorchester Mental Health Center. I'm a counselor by nature, but I'm embedded inside the Charleston County Sheriff's Office. I'm able to help the detective's office with the victims or complainants that come through the office that are going through mental health crises. I'm here for them to be giving them support, counseling. I get pulled from the hallway all the time, whether that's someone's questioning about some mental health diagnoses or consulting with me on just what to look for, what to ask, how to talk to people in a trauma-informed way, which is great. This type of program is first of its kind in South Carolina. I think the Sheriff's Office has always been really open to different community resources, and so I think that's why people like me are here.
I'm Captain Rita Avila with the Charleston County Sheriff's Office Crisis Negotiation Team. Our main purpose of the CNT team is to respond to crisis situations where someone may be barricaded or refusing to come out and speak with officers, whether they're going to be arrested or they need mental health care and we need to help transport them. We are specially trained to be able to sit down and talk with them over the phone, face to face, or through a barricade, that we can communicate with them, and really our goal is to find a peaceful resolution. We meet once a month, and then quarterly we meet as a low country team, and that involves all of the agencies in the Tri-County area. When we do the low country team, a lot of times we'll have different instructors from a wide variety of specialties come in, and NAMI has been a huge part of that, and that's been very beneficial to our team.
I'm Master Deputy Frichtel with Charleston County Sheriff's Office. I'm assigned with the Special Operations Division through the probate court. Their purpose is to deal with those that are mentally ill. I also teach with NAMI and teach crisis intervention to the Sheriff's Office as well as partnership agencies, City of Charleston, Mount Pleasant, and North Charleston. For many years, NAMI has taught crisis intervention, and the original purpose behind their teaching crisis intervention was for our crisis negotiators. But every law enforcement officer deals with people in crisis, and they do so every day, and they do so well. But the doing something well doesn't mean that they're doing the best job they can. There's always more room for growth, so those doors opened up for law enforcement to be taught crisis intervention through NAMI. We also extend it to our detention deputies. When the people are incarcerated, there's a lot of crisis that goes on there as well. We also have a partnership with the clinical directors of all the major hospitals in the area. MUSC, Palmetto, Trident, these doctors actually come in and teach law enforcement. I don't know many trainings that's going to have clinical doctors come in and actually teach law enforcement how to deal with the mentally ill.
My name is Dan Maddock. I'm a lieutenant with the Charleston County Sheriff's Office. I currently help administer the CIT program. The beginning portion of it, we've got clinicians and medical professionals that come in and help talk about the biology of mental illness. Then we move from there to community side of it, where we have folks that either have mental illness or are taking care of folks that have mental illness to come in and share about their stories. Our folks then participate in role playing, where they use the skills that they were taught throughout the week in the culmination to be able to role play to help de-escalate a situation. Seems like now there's just such an increase in the type of calls that we go on. It's so important to help law enforcement be able to identify if somebody is in a mental health crisis, regardless of whether or not there's criminal activity.
When people are in crisis, there's emotional thinking and rational thinking. In order to get somebody out of emotional thinking, you have to get them into a rational frame of thought. And that's where law enforcement comes in that are trained in dealing with crisis negotiation. How can one law enforcement officer walk up on a scene and have non-compliance from the moment he steps out of the car and walks up to the subject? However, you can have the backup officer walk up and gain immediate compliance. Why is that? It's because 93% of this communication happened when he stepped out of the car and started dealing with the person. When you set the tone with good communication, and that is creating a dialogue, you can pull somebody out of a crisis. Our biggest weapon in law enforcement isn't the gun, isn't the badge, it's the way we communicate. I had one student come to me afterwards and say that he tried this with his wife and it worked very well. And then I had another one say that he tried it with his child and it did not. Not everything that we hand them in trainings is going to work 100% of the time. However, these are extra tools in their tool belt. All this has come together through a partnership that we have with NAMI and through the Charleston Dorchester Mental Health Center and through all the personnel that actually helped put the program on. Without them, our law enforcement would just be always doing what we've always done and getting always the same results. We're starting to see that mental health services are key. On every single police car you see serve and protect. That's where we want to be, is serving and protecting, but how do we get there? We can't get there doing what we've always been doing. There's a lot of changes that we have to make to actually serve and protect.